functional GI disorder, the anxiety disorder, the depression, or organism. The organisms maybe be careful because we have a dopamine and then the BS the eroism. So they find the change in the makeup, the behavior many of the record players, and the scientific the literature is filled with such a observation. However, developing the therapist targets such that the change has generally the ability to provide the symptomatic relief for the patient with the dirty disorder. On the other hand, on the respect then changing in the playbooks is brain to more positive score. It is goal of the electric in the gut reaction and thereby the reversing in the cellular to change in the gut. It's a more promising the studies the currently underway to determine if the microbial the change is associated with a positive mind-based intervention. The such a hypothesis in the meditation and if there to change due to symptom improvement in the such disorder is a irritable bowel syndrome. Okay, so this page is I want to summarize. We have got sometimes we will connect this brain and then emotionally and then physically. They are very competitive. So it's a brain here. The brain and the gut, the physically, the movement, and the emotion, and the nutrition. Okay, and then also this one together here. Okay, so usually we have the plus, the plus minus the hormone here, the serotonin, dopamine, endorphin. Then we have the cholesterol, the stress hormone, adrenaline. So we have the plus, the happy hormone is the serotonin and the dopamine. Also here, endorphin. Also we have the serotonin, the melatonin. Yeah, both together they support the nutrition and then the physical movement and this one. So the gut, the serotonin, the hormone, reproduction, 80%. Yeah, so the many girls said that people over time order to the accommodate the stage, the direction is the low connection in the enteric nervous system. And also the sensor in the gut became more sensitive. So we have the second brain here. So when you are eating out with our people and the family member, or the company, or the friend, the best friend, eating out the restaurant here. So we discuss over the dialogue, conversation, and the matter where is more positively they give to we have the 5 kind sensitive sensor because we have ear, the listen, and the nose, the smell, the mouth with the train, and the eyes with the visually it's more the texture, and with the finger with the touch. So we 5 kind of sense with the sensor they give the brain, the sensor here. So here EQ, IQ. So this gut and the sensor together. The gut condition also they have the 5 kind of the sensor they give to the brain. the brain sensor EQ, they have the control, so all the body, the control, and so they together go on, and then second brain, because this is here, 30% the brain, and the God had God brain, second brain, so they have to cover the 70%. So God health is good. Mood is okay, emotion is okay, and then physically it's okay, and this one too, the nutrition okay. So work together. The God is very important here in the body, okay? Also GI disorder too. It's not surprised that when the scientists study the God in the patient in the functional the GI disorder, anxiety disorder, the depression, orgasm. Orgasm too. We have here the serotonin, dopamine, endocrine, the orgasm plus orgasm here. Also the GI number is very important here. So because the 74th page here, irritable bowel syndrome. IBS. But usually there's a problem here because we have the constipation, the diarrhea. So the IBS problem here, irritable bowel syndrome, the diarrhea. This is the normal, and the diarrhea. The depression is more top here, is more the constitution down here. So IBS is here because they sensitive here, the gut here too. They connect here. So maybe anxiety is more here. The depression here. Okay. Anxiety, depression. So up and down here, irritable bowel syndrome, they from the gut the influence here. Okay. However, developing the therapist target is such a gut change has a genetic path to provide the system relieve the patient with the disorder. So yesterday, my patient came to my clinic. So husband and wife came to my clinic. So they have the pain suffer from the multiple pain the syndrome. The husband have the stretch the high low, and then they twist the body. So but the husband is okay. I give the treatment plans by the time, and then. They have problems of GI number and the low, and then the circulation and the digestion is a problem. Also the wife too, the digestion system is very low because she have no energy and she is more obesity and the BMI, the body mass index is more different because we height and the weight is balanced, but she have the overweight. So she little more lose weight, 10 pounds. Also she have the mineral, the vitamin, the balance incorrect. So because she have the 5 kind of medication from the doctor, so they but she have take the vitamin only just multivitamin. So I explained to her, sometimes it's a nutrition, it's overdose or the malnutrition because. Long time ago, I'm here. Vitamin, the vitamin mineral, 1970, because this areas we have the industry farm and then the very industry here. This modern, we have the industry is very technically we need to change it, right? So before we have the malnutrition because we don't have that much the choice, only the basic the palm. But because we have the factory here and it's manufacture not too much. So we use naturally, so they have the maybe the mineral and the vitamins very the rich, microelement, right? But now here too much the factory manufacture, so many the dioxin, the pollution, so many includes here. So this compare the mineral, all kind of fruit and vegetable, the grain, too much of pesticide using, and then because they have too much the pollution, they more the micronutrients are very low. So before the apple 1, now apple 10. So this value here. So now too much. Too much. Too much we eating out, the fast food, the junk food, there's so many the medication and the mineral, the vitamins are definitely here. So it's malnutrition. The before we have no choice of food and then products, so we can the balance. But now for 2024, imbalance because there's too many the problem is the industry and we have good the benefits convenience, it's a more choice, but you have a problem, so many problems here, and then it's a micronutrition low function, so malnutrition the different. Okay, so if we have so many the medication, you need to cover micronutrition, very important here. Okay. Page 73. On the other hand, one would expect changing the playbooks of the brain to the more the positive story, with the goal of altering the gut reaction and thereby receiving the cellular change in the gut is more the promising, and the students that's currently underway to determine if the gut microbial change occurs in the positive and then mind-based intervention. Does this mean? The positive here, the negative. Put to the mind. Okay, life is 10. Okay. We have the food here. The behavior in the mind emotion. Okay, we have the positive mind and then we have negative mind here. We level him. So if you have the food, the vegetable and the meat, the fast food, and the fruit, the cup, the sugar, the behavior, more music, and the living, the jogging, the aerobic here. Is mind maybe with the positive section here, positive, the piece of the heart. This is here. Is negative here, the meat, the past is more convenience, the hand, the food. The negative is we have the stressful, and overwork, and the anxiety too here. So this diagram here, the test. Yeah, if your choice of food is more vegetable, more healthy the food and the more grain, and because maybe the brown rice, for example, brown rice, and the jasmine rice, the GIs are down, and the more white rice, the heat. It's a more profitable section here, and the behavior. So maybe you can stay more on the musical, the clash or the piano or violin. The music is more peace of your mind. It's more the calm down, and then you are more the stressful. It's more the stable here. But you can maybe choose the music, maybe rock or dance or nightclub. The music they more anxiety, they more pump the heart, and then they more the tight here. Also mind. So if you have a more positive mind, so your maybe mind is your body is more the good sense of the function and all the kind of cell and the muscular system and the joint and the bone, and then the white cell, the immune system better activity here. But you have a stress, anxiety, the too much stress, yeah, overwork, and the day want to stay here. It's a more body, it's not correct here. Yeah, so they have it here, the too much stress put here, your body immune system very low. Yeah, so you have the food, the emotion, the behavior, they have the lifespan, you are more decided here, more good health. You see here, yeah, more the body, have an explorer, the disease and the symptom. Yeah, so we have the balance. So if you are good health, the life is more choose more the organic food or the healthy food. Okay, and the behavior, yeah, you can more stable, more the listening the music, very slow the music. Yeah, the flute, violin, the cello. Yeah, cello is very good. Yeah. So morning time, the cello is much better, and the violin is more night time is much better. Yeah. So and then also you have too many the medication problem. Yeah. So many people the medication, medication and plus supplement too much overdose. So we don't need to a lot of the medication, but antibiotic very important. So emergency they antibiotic very good. Medication, but the other kind of the medication you have to install the natural body and then more homemade and then more tea. So you have to the decision, okay? Because the doctor not save your life. The 50%, okay? Yeah, don't depend on the 100% is the doctor, okay? So you have to the lifespan, the maintenance your overall your life the span, and then you have to maintenance your health and the medication, and then annually you have to check your blood test and your health the symptom, the body sign. Yeah, you can put keep your lifestyle. Okay. Yeah, page 74. Okay, we check here. A guide the physically the stability for collecting the emotional health. Yeah, this is the article at the 2024 the Sunshine in the Mountain, the newspaper. A guide summarizing the stability correlating emotional health. Emotional health is an important aspect of overall well-being. It encompasses the ability to manage and express emotion in a healthy way, to maintain the satisfied relationship and cope with our life challenging. Just as we promised, prioritize our physical health through exercise and proper nutrition, the paying attention to emotional health is essential in the cycle is well-being. One of the key elements of developing the emotional health is self-awareness. He's involved in determining the understanding your own feelings, thoughts, and then behavior. So we like to spend here the very important here. Being true in your inner world. Inner world is you have the God health. You can better manage stress, regulate your emotion, and then make an informed decision. Yeah, 3 years ago we launched the decision, the problem, right? That some people they can change it because it's, some have happened the issue. We have to try to change it or result or the way. But some people they have a problem, the decision, the problem. So this is where we got has in the brain and the emotionally and the physically and then the psychologically, so they connect. So the practice such as the mindfulness, the meditation, journaling, and the pray that can help you increase your self awareness here. Another important aspect of emotional health is breathing, resilience. Resilience is the ability to bounce back from the setbacks, adapt to change, and cope with the adversity. Developing resilience requires the cognitive optimism, the problem-solving skill, the social support network. Yeah, usually the decision, the syndrome people are very difficult because problem solving the skill and the social support network. So maybe depression people, the stable people, they want to block the heart, the outside people, they don't want to come in this bother it's my situation that they stay home. So they want to block broken is a relationship, it's a network. So the problem, only things by self and the decision by self. So it's sometimes a wrong way. So somebody want help to them, they have must have to take open or the candidate is open. It's much better. But some people, depression, the panic or depression people, yeah, it's not easy. It's open mind. So we have to, because the depression people and then people had they skip meal. Usually the breakfast time, because of too many people that skip the breakfast. So the breakfast skip sometimes the damage of the brain hurts. So we have to must have to keep the breakfast, okay? Effective communication is also excellent to maintaining the emotional health. Yeah, the communication is very important. So we can live by self in the world. So we need more exposure where the strong point or the past strong in mind, and we have to connect with the mind order, and then we need more the cooperation or we have the give and take is more the communication we together. So it's very important here. The clear, open communication is order can help prevent misunderstanding, resolve the conflict, and the strong in one relationship. Yes, A, B. So A person keep the more open mind, and then he open mind is more try to keep good relationship, and because she explained the situation by herself. But B first, the hiding some issue, and then only the 20% outside the view is more is for the situation. The 80% only keep the by self. So you see the no, it's good that has the communication, because only one side is 1/8 the communication is no good. Okay, the relationship 50% only we have the getting, and then we open together. To share the opinion, the heart and the behavior, and we together it's more good communication. We can make growing the more relationship partnership. But only the give and take, no, only 1/8. It's not connected to a good relationship. Okay. Active listening, empathy, and then assertive key component of healthy communication. By expressing the thoughts, feeling, the constraints, individual can form the positive relationship with others. Sometimes we meet the people, they have problem. Only one person talking a lot, and also so many people when you just listen to him the speech. Yeah, so this the connecting the relationship is not the wrong way because so much because of give and take. Some people talk about 30 minutes, 30 minutes the speech, and then other people listen and the time, and then the other person the speech is 30 minutes. It's a good relationship. But only one person 20 minutes, 1 hour the talking, and then the 4 people listening. Yeah, remember maybe it's broken. It's not controlled in the member the harmony. So this research here. If you wanna the mid person, the speech, 30 minutes, and the listening, the 7 minutes. Maybe you make more. The good relationship with the other people here, more member here. But 7 minutes and then 7 minute speech, 3 minutes, they have more, less the management and the relationship is down. So if you wanna the mid person, you can keep it A. 3 minutes the speech, the 7 minute listening is much better, and you make a good relationship with other people. Okay. By expressing the thought and the feeling, the constantly individual can form the positive relationship in the others. So if you want to meet the people, maybe you have sometimes you have a positive thought, but sometimes you have a negative thought. But you have you want to keep good relationship with other people. You can try to express more the positive thing or positive thought in the mind and then behavior. So they have a good memory you. So we keep going some more growing together with a good relationship. Okay. The setting the boundaries is another important aspect of developing emotional health. The boundary help the individual setting limits to protect his well-being. The boundary, so we have the boundary here. So many people boundary here. The home, the school, the work, the church, and the sports. Usually maybe 80% people they want to keep the boundary here, but 20% is outlier. Other people, 20 people they want to change it out with the boundary area. So sometimes it's a very positive the view. 20% they maybe more good build a relationship, and then more rich people or they more leaders over the world, and 80% they are more comfortable here. So 80% people want to keep the boundary area. So they want to know the stressful and more the damage of life. Okay, the financially or the body or the thought here. Or usually 20% they more adventure here. The challenge person. It's a leader. But they have more anxiety, the dangers. You have disease. We have the damage. You have to discover the damage here. So 80% the level of poverty people they will keep the boundary area. Some poll page, how the brain program the gut emotional response. Today we know great deals about how emotion affect our body. including our GI tract. We have the yes, we know the great deal about how emotion impact our bodies, including our GI tract. To understand how these work, you first need to know about the linkage system. The primitive brain system we have with others, warm the blood animals, and that play major role generating your emotion. The deep in your great matter, emotion, the specific, the circulate in the limbic system, the adaptive when you're angry, the scared, the feel sexually adaptive, it hurt, and also when you feel hungry or thirsty. Yeah, so the GI tract here. Yeah, the GI tract here, GI tract here. So we have the feeling. So you ever attract by the strange person, the hungry, thirsty. Also here, the happy, the joyful life, the peace. Yes, so endorphin over your endorphin or dopamine. The by achievement is something, right? So the GI tract have the 12 ocean here. One is more the negative section here. The security or some the elected by the strange person, the sexual harassment. They have more appeal here. Also, is the point of here more happy and the more the joyful life and the more hungry the achievement or the dopamine and the serotonin by the achievement here. They have the small instinct here, the GI, the light instinct here, the small instinct here. The GI instinct is very important here. They are the plus, this minus. So because we make the serotonin hormones 80% here, we make it here. So we compare this one. Deep in your the gray matters, emotion, secrets, and within the limbic system, get addictive when you're angry, is scared. You feel sexual addictive. The heart also when you feel hungry or thirsty here. Like our managed supercomputer, the circulating and just our body respond to the ultimately change both inside and outside our body. So inside here, the joystick here, inside the body here. Inside here, maybe it's outside here. Yeah, if it was scary and thirsty or harassment or some attacked by the people outside our bodies, the sense is maybe living of movement. Because we have somebody, the strange people coming here, we're scared, we're changing the movement and we are dispensing something, right? But we have some more happy and then more the joyful, more terrified with something, the happy person. Maybe we make the share. It's a more open mind and the more movement, so more the freedom, right? So this one, the GI, the track, also, and we have the emotional issue and the outside body and the inside body. We connect. They have to work together. Okay. we are all families. What happened next? The emotion related brain, quickly the signals, the stomach and the intestine, needed then settle over the contents. The might be otherwise drain energy required for action, which is why it might lead to hit the bathroom before your big presentation. Our cardiovascular system releases oxygen rich blood from gut, the muscle, the slowing the digestion and the preparing of the pipe. Think about it. Sometimes we have stress. Stressful, but we will try to do easy. It's empty the stomach. So when is more happy? Because when is happy make the bathroom work. The pee or the poo. Sometimes we have stressful. It's not easy to come out and enter the stomach because they have the stomach have the sense of the brain together. So maybe the scared, maybe our body maybe more comfortable and then more exposed to more the safer place. It's more easy. It's a pee and we have poo. But we have scared and then dirty or arrested by the study people. We have to keep your body, and some entering the supplement. Maybe it's not easy. So some people, scientific person, they usually have the constipation and or diarrhea. So we have this irritable body syndrome, bowel syndrome, IBS, because they kind of people have problem and we have bathroom problem too. So if you wanna regularly keep maintenance the bathroom problem, you have to more joyful, more don't too much the stress. Okay, it's more like a positive thing and more the peace of mind. You can easy more the empty of stomach. Okay. We are now alone in the animal kingdoms in their blood experience, the billion over years. Many must have the needed to bond, the bite, assess the potential, the thirst, the sometimes proof. The information had to be stored in often the collective wisdom about how to best respond to the situation and has packaging that wisdom to the specific the squarence, the program is great the relation to their automatically. This saves time and energy in the moment of request because without such a hard-word response, we have to start from the start and each time. The programs known as emotional operating program that can activate with biosystems implementing the coordinate over the behavior and allow to more survive, talk and reproduce. So the GI tract sometimes connects with the circumstance and we have the more the challenge of life change. So it's major over the health. It's from the GI, the tract, some maintenance. Okay. The practicing self-compassion also essential the emotional well-being. The self-compassion involves training yourself in kindness, understanding the acceptance, especially when time is thought to your pair. Collecting self-compassion can help individuals to build emotional resilience, increase our self-esteem, develop positive self-image. The engaging in self-care practice, such as relation technique, the hobby, or self-depression, can promote our self-compassion. So this later we learn to detect the emotional freedom. The sensor is the connect. Okay. Also, God help the God connect with the emotional feeling. The collecting emotional health essence to achieving psychologically the stability by developing a self-awareness, building resilience, the trusting, achieve communication, the setting the boundaries. We already explained the boundaries. Setting the boundaries and clubbing the compassion. You can increase your emotional well-being and then copy your life challenge. The prioritizing your emotional health is key aspect of our self-care. the overall release. By taking activities that the collective emotional health, individual can need more developing and the balance of life. Okay, so it's a life balance very important. So we have the emotionally, the physically, and the momentary, and then you have the nutritionally. So we have the plus the positive side is more the good health, the good lifespan. Okay. The 75 page here. Jack Pankisfeld, neuroscience. He worked at Washington State University. She have the main important contribution in the field of relative neuroscience. Yeah, now so modern people, the modern science, since they more the research over the brain issue, brainstorming, and then lower the circulation, the body. Before, usually the science they have only the focus on one part, but now they have the comparative section, the cycles where but before with the device or body, the physically and the nutritionally or emotionally, but now they combine. So it's a jack function. They more research for the connect. It's more neuroscience. Okay. Which the applies the neuroscience to study about emotion. That has completed from experience or animal that our brain have the less 7 emotional operating program that directs body response to fear, anger, the scroll, pleasure, love, and the mental the nutrients. They will execute the appropriate set by the response quickly or automatically. Even when you don't know you feeling hurt emotion. They make your face the first when you feel embarrassed, you give your first bump. When you watch the scary movie, they make your heart beat faster. When you're scared, make your gut more sensitive in your body. 30 years ago, I visited Japan, Nagasaki. They have the very famous the first facility, the house name is House Campus. They have the secretary view, the building or the view. They by the French, England, and so they have the factures very antique and they have the powerful and a very good view. So I show the cinema, the 3D. Before now the 3D 4D is very popular, but a long time ago. Very strange sensation. So we have a movie, we have the glass, and I have movies, but inside here the waters, maybe it's like the near water. They're scared. What about how can I go? Maybe under jump over here. Yes, but it's the cyber stage of movies, the 3Ds. Yeah, the very sensation because we see the dark, the screen. And you only the people here, but we see maybe the visual part of the view of the sea. So very dangerous, but it's not danger. Only the cinema, but with the IMAX and the or submitting the movie, the 3D. So feelings. Now almost past the 30 years, I have imaging memory because there is with my sensor. Oh, this movies so maybe strange. So anytime maybe you can appear. You are maybe some you be the home TV or home the movie and convert via your the screen, but CJV were different, right? It was activity more the live strong, right? Yeah. So this the diode here, the jack the technique, it's a more diaper in the square, and then the stable, the views are different. So you can buy this or object is sensible here. So more the peer, angle, the score, the play is more, you stay more in the memories. Yeah, long time, because we have the trauma too, right? The trauma is sometimes we have the good emotion, good memory. Sometimes we forgot, but we have the negative image or memory. We keep a long time, so we need more treatment for the trauma. It's medical for the more the future, right? So maybe sometimes we have to bring to the past, the trauma. We present in the future, keep going. Yeah, sometimes we have the emotionally, it's not hurt, okay? They skills the operate serve body response quickly and automatically, even when you don't know you are feeling the particular emotion. They make your face press and your feel immerse, give you a ghost bumps when you watch the scary movie, make your heart. The body faster when you are scared, and make your gut more sensible when you are worried. So sometimes they will notice, sometimes notice they connect the body, the sensible, usually more hot and more pump, right? And the body is shaking, and then sometimes we have the scared, we are more limit of movement. So maybe just one time, couple times is okay. Maybe keep going 2 months, 3 months, 4 months, maybe problem. Maybe your body, the sign is more negative. Okay, so we have the control it. We are the upset. It's well, some people they're angry or the stressed people. We don't need to meet the people, right? So only the meet the more positive the people is much better. Our emotional operating the program. What is our genes? This genetic coding is part of the inherited from the parents. It is also influenced by the events we experienced early in the life. Yeah, we have the childhood trauma. Yeah, usually we have dependent. We have my parents, or grandpa or grandma, right? So because we have a child, so and these strange people did not keep coming to our parents from. Usually we have spend the 24 hours. We have the boundary over my family. So sometimes the parents, maybe good parents, give the more to emotion to attitude, or they give positive things. They more comfortably or freedom over open mind, and they easily make more friendship. But some people, negative parents, they give the impress or give the child. They have to stay home, and then they're very shy, and then they want to now open the heart, and then they don't want to make it a good friend. So most people, child, they come impress of the parents. Okay. For example, you may have the inherited genes that predispose your fear or anger program to overreact to the stressful situation. If you also experience the emotional trauma as a child, your body already chemical tax is they give stress response or gene. So next results, there is some more others you are most likely experience. Education is called relation to stress. This explains the common obligation to individual exposed to more same the stressful. The stressful situation may show more different reaction to it. While the owner that experience any more noticeable good reaction, the others on is more captive by inertia, the stomach, cramp, and the diarrhea. So while the early programming for trouble may be good things for surviving, your dangerous or it is more liability if your liver in the safety or protect environment. So some people, negative people person, they have more diarrhea, and the anxiety people they have more competition. So irritable bowel syndrome usually have the depression people they more often is more issue. Okay, So I have a memory. My dad passed away last year. It's my memory. The childhood, maybe elementary school, maybe fourth grade. It's my school. The subject score very low. Then it's the friend. Yeah, so friends, we live together. The bond, same the bond really. This my friends very good. 100% more score, but my score is very down. So my dad score me is front of my friend. So I'm very upset. I'm embarrassed about my friend, and it's not happy. But now so almost 40 years and live past time, but still I have some angry with my dad because embarrassed. Yeah, it's not happy. But the childhood so long time, almost 45 years problem, but still I have a kid. Yeah, so yeah, sometimes I talk to my dad. Yeah, he's not happy because maybe because my sister, younger brothers, they have more good work. Yeah, but I talked with my dad. I have a problem because you remember you screamed me a long time ago, but he's not remember. Yeah, so it's not more. It's not more. Because it's my feelings is bad, but I told to my dad, I want maybe I have a baby. I want maybe son or daughter. Maybe after the marriage, I want to give it a good, positive things or more. Otherwise, more limited, more the achievement or something. I'm more chill. Yeah, so a little changes my behavior, and then I promises my dad, my mom. So I give to more love. It's my child. Yeah. So sometimes the trauma, how is my that side here, right? But sometimes this trauma you can make more changes your lifestyle or behavior, and then you can do more to change your life. It's very important. So how can you control your trauma? Okay. Okay, we have the breaks, maybe 5 minutes. Okay, yeah, you can get your question or copy to read. Okay. Okay. The links between the breathing and the emotional well-being. You can show the picture here. It's Alaska here. Yeah. Also, we have the breathing and the shadow. Shadow. Okay. Yeah. You want to stay light, right? The survival. So we little must have to how to keep the breathing, the short or deep. Okay. The AM, the PM. Okay. When you're breathing, how about the breathing your habit? Usually you are more the short breathing or more deep breathing. The short, usually short is a noise, in, out, the mouth. Okay, it's very important to your lifespan here. Usually the deep breath, your arm is more chest often here. The load in the outside here. So load inside is air, maybe the hot or cold, the pressure, they would noise they have a filter. So they give them more press deep here, the chest. Chest is more up, okay? It's on the deep. Because here air. So we have a pollution, dry air, the cold air, warm air. So they're in here. In here, more we have chest is open here. Now out, it's down, right? Yes, out, down here. So the deep breath here very important to our body because they give you oxygen, right? There's oxygen and come out the CO2 here, right? So oxygen here that came here, we separate all the body. Yeah, especially the God has a GI tract, they give more oxygen here. So you open the body, but organs more have a space more of the breathing here. But short breathing here, little nose, or mouth. So mouth very heavily we are damage over the respiratory system and the GI tract the problem. Because we have pollution air or any kind of air that directly come here, they will respiratory product the function very low. They open the bacteria, so by the sun, right? And then the dust too. So they give the body the effect. Or low split here, the chest just stay here. So we have the respiratory function. We have the lung function is more. We need more space, and we can more the plumbing here. The function, but the lowest noise is a very stable here. It's a very short. It's the more using the energy. Okay, and the lowest, the deep pulse is more. Here, more receive the energy. Okay, yeah, because noise maybe using more energy. All kind of heart and then more liver, they need more work. So more energy damage. So many people have problem. This noise, mouth, the problem. Because some people, the sinus people, they using the second here. The AM, usually AM, deep breath much better. And the PM is short. And short much better. Okay? So the short, because of PM, after 7 p.m. after we finish dinner, everything the work finished. So we had the more comfortable section here. So because the sleeping time, you don't need a deep breath. Only to keep the maintenance of your overall of the body, the organ, just maintenance. So we need not too much the oxygen here. So we have set the energy here. So usually it's morning time, the daily time more deep breath, more the keep emotionally it's more the stable, more comfortable. Okay. So sometimes you have the stress, anxiety. When you have the stress or anxiety, you have more deep breath. It's more comfortable, so you can more good idea, or you can make the good sense of the decision. Okay. So very important here, the deep breathing here. And also the shadow. You have a shadow. Maybe I have a shadow here in my body here. Because they have the issue, the shadow. Maybe I have maybe you can see the mirrors every morning. Maybe you wake up every morning, you go to the bathroom, you can see the mirror. But sometimes your face, maybe last time, maybe good health, more no condition or any kind of stress, nothing. Maybe cheerful and then more happy face. You can see the face, happy face, right? But sometimes you have stress or overnight you movie or drinking alcohol or stressful life. It's ugly, right? It's not. So my heart is maybe ugly, maybe mirrors ugly. Happy is happy. The shadow. So they have usually maybe the people, are you okay? Because I'm very fine, but it's my face is not fine. So some people see your face, are you okay? So maybe some they notice my feeling because the face we expose your heart, the situation. So sometimes your the situation very bad, but you can smile and then more. You think the smile, mind is smile, and the day we put more skin or face, it's more that you can figure out the people. So if you have a problem, maybe try the deep breath, and then you can change the mind. Mind is coming, okay? So more positively smile. If your face is more happy person, the people is more easy, the hand, or you work together, okay? So sometimes the mind medicine here, the functional medicine or the mind medicine work together. Okay? When the page 76, when the God gathers trust, overall our emotional operating program, the one that engage the stressful event among the best studies. When it feels anxiety or fearful, your stress response is a way to work. So trying to maintain the homeostasis or internal balance in the pace of internal, external health. Sure. So if you have a stress, but sometimes it's not happy. Or you have the body know that. I told you the last 2 years ago, right? 2 years ago, I have probably my health issue, but I have to treatment my patient. So, but it's not. I can express to my patient. I have stress. It's my body is medically is a very serious problem. I don't talk to the patient because I know it's my job. I have to work. I have to money. I have to my life. So sometimes I'm stressful, but sometimes I have to keep myself and then don't transfer the other people. So just here because sometimes you have stress. Some people have too much. I have stress, so that's why I'm angry for you. Usually a husband and wife problem relationship, right? Some people have stress. We have to don't give the child or the partner or the husband and wife don't give to them angry or the behavior the issue because sometimes stress only keeps myself is okay, but sometimes it's my stress. The mood is very bad, and also one of the patient have the family mood is very down. Maybe cancer patients especially. Yeah, also the dementia, the patient have the maybe husband wife one side they have the dementia, maybe the partner transfer the disease, so they have to get both have mood is down. Okay, so the stress mood is very easy to transfer the position, the mood. Okay, so you have to keep your stress myself. Okay. When he talks about stress, we usually talk about stress from daily living, the pressure, the larger the stressor, the such a trauma, the natural distress. Yeah, sometimes the trauma and then distress maybe overflow some village or tornado have a village over the Florida, right? The couple years ago, they have a very serious stressful because they had to empty house, they had to left the vehicle or they had to more the escape from the village, right? There's too much stress because they have the job or any plans, any damage. Yeah, so yeah, because they have the disorder and then natural disorder or trauma. Yeah, can give my limits, my movement, my lifespan. So anybody is not happy, okay? So they want the safety, yeah. But now so many people have the stress for the modern life. Yeah, more convenience or more easy, more choice and more option than the last the generation. Yeah, 1990 or 2024 very different because we change more technically or more the changeable manufacture all the world. And then the before I have a World War II, but now maybe anybody worry about the World War III, right? So now so we can control myself, but we have at least we have to kiss the body or my condition is my myself. Yeah, they try so trauma sometimes the trauma from outside people came here. You can make it on the trauma. You can make it myself. Yeah, anybody. Yeah, somebody give the trauma, right? In the lecturer they start to too. We don't have a choice. They have the only offset, right? So if possibly we have to safely will escape from the lecturer disorder and or trauma, we have to maintain by the lifestyle. Okay, this is much better. But your brain also perceives many bodily events that stressful, including the infection, the surgery, accidents, the food poisoning, the sleeping defect, attempting to stop smoking, or even something the lecture, hormones, the menstrual period. 6 months ago, after I had a car accident with my freeway, yeah, it's Saturday. You remember, right? I skipped your class one time. I'm very, very safely driving because of lane low. And I'm sliding. Suddenly I was sliding and then we roll over 3 times, almost die. Yeah, so it's a miracle. I survived by the car accident. But now, every Saturday, I have to come here. So I passed the accident place. The still I have trauma. It's longest. And then more the handle was shaking because I was just short time, 30 seconds we have the accident. It's myself, right? So sometimes we have the health issue. It's very stressful to worry about because of cancer or it's okay or not. So usually we have to believe or the doctor comment by the blood test, right? So sometimes we don't have to test anything, we don't know what about it, right? But we have a paper, we worry about it. Yeah, because of trauma, right? We are pair or the stressful. Because the doctor say, yeah, sometimes this kind of people, it's myself, oh, I think it's cancer. Maybe sometimes it's very worried about it, right? It's stressful. And then go to the doctor say, you are normal. But still, I have a worry about that. Because why? I think it's my body have cancer, but doctor say no, you're okay, you're no cancer. Are you okay? Really? You true? Yeah, because your memory here, brain, have a input of I am a cancer patient. So sometimes doctor give the sense of your baby, you have cancer, is more comfortable. It's not happy. You understand? Maybe doctor give the answer, oh, you're not cancer, I had to be happy. But sometimes they have too much stressful here, the input here, I have cancer, my patient, I have a cancer patient. So doctor give to your cancer patient is more comfortable. But usually doctor give the answer, or no, you are fine, you are normal. That are you seriously, are you okay? Really? Yeah, more question because I own my opinions, my decision because it's because we are imagine, right? Imagine I have cancer, maybe somebody give the advice, not easy to change. Yeah, so this is here. So we have here over the health issue very stressful, and also 3 years ago we study, right? The before 2000 they have a more the family issue, maybe pass away or the parents or divorce or financial bankruptcy or lose job or something. But now the change lifestyle, now health. Yeah, health issue very important. And the second is financial aid, and third is more family the pass away, and then the divorce. So now the so many changes in the culture. Yeah, so now we have to keep the health is very number one, and then second the financial or the family issue. Yeah, it's much your maintenance. Okay, so where parties you give a position or focus, your life is more changing. Okay. Also, women's mental the period. Yeah, I saw the YouTuber they have the you have a sun, right? And the moon. YouTubers say it's an evidence. I should try more reading the evidence here. The sun, because sun here usually 10 a.m. to 11 a.m. we expose the natural sun 10 minutes, 20 minutes. We make the serotonin, melatonin, dopamine, endorphin. Also, we support the 20 kind of hormone, the reproduction. So usually every day is for your body 20 minutes, 10 a.m. to 11 a.m. You're more the positive to your body, mind medicine, and the more mind imaging, and then your health very helpful, and then you can go sleep here. But here they give the testimonial, the moon, maybe 10 p.m., 1 p.m., 1 a.m. So usually here you have growth hormone and also we have melatonin. Two hormones is very important here. We are sleeping time. But this outside here, maybe for example, maybe Christmas or Happy New Year. Usually everybody wants outside, right? They firework, right? So they start here, very dangerous. Usually they have more the moon days. They have more car accidents, more they injury people, and the more the mental problem, people here, the outside here. So because they have it, because we live about 10 p.m. to 10 p.m. to 1 a.m. we live relax because we had the body, the cleaning, recovery cell or all kind of body, the cleaning, reproduction, regeneration here. When it's open, the baby wake up here, they have a mental problem here. Usually they have a problem here. Yeah, so at least we have to keep 10 p.m. 3 p.m. It's 5 hours. We have to keep this REM sleep. Keep it much better, okay? For health and the mental disorder too. And then also the woman, the menstrual period here, you don't have the more sensitive. So we have some the episode where the famous comedian wife have the problem. He sit at the department store when have the period time. So all the time they have a problem. The woman want to outside in the department store. They are hiding or the steal something item. So also they have the very sensitive. So more arguments, more numbers. So maybe touch the argue the people. They more eventually they have the issue, the accident. Okay. So you have to don't touch this kind of woman's menstrual period time. Don't argue the woman, okay? Very dangerous. Let's put back to 13. What happened in your body when you are stressed? But first, you need to know more about the emotional, the brain's impressive ability. It's like trading with the situation, showcase them the best. Okay, you can see here the screen. Yeah, breathing is a fundamental aspect of our being. It's an automatic process we often take for granted, but it plays the circle role in our physical and emotional well-being. They raise breathing in the direct impact on our nervous system, affecting our mood, the stress level, and overall mental health. So the short, the deep, so more deep breaths, they more the separate more overall the health, and then like the stress level control, and then the mental control, and then behavior control. Okay. When it's stress or anxiety, the breathing tends to become the slow and then repeat. Yeah. So we have stress, more deep breath, the slow down. So the in and the stop maybe 2 seconds, and slowly out. It's more maybe 5 times. It's much better because for the mental health. So if you want to argue some people, just come down, just 1 minute. Try to the deep breath. It's much better. Okay. Yeah, good decision. Some just argue too much temper and anxiety when you don't respect the speech word. Okay. So you come down just 1 minute. Try to the deep breath. This activity is more symptomatic nervous system that targeting body to fight or fight the response. This kind of worsen building over anxiety and then overburden, creating negative cycle of stress and tension. On the other hand, when you are climbing the relaxed, our breathing became more slow, deep, activating the more parasympathetic nervous system and then promoting the peace and well-being. So the stressful mind have too much the limit or the cycle or psychologically, physically, the movement or emotionally have a problem. Okay, so you are depressed, they may suffer all kind of maybe the physically or especially the digestion GI tract, some more good digest and the more the decision or the movement. So they the support, okay? The deep breath is very important. And then they more safety, okay? Too much noise maybe will limit movement. The practicing mindful breathing, the techniques can help you regulate your emotion and improve the mental health. By focusing the breathing and then concisely the slowing down, you can shift your nervous system into a state of relaxation. This can help reduce anxiety, the stress, and the depression, and promote the feeling of clarity. So the depressed very helpful overall maintenance of my heart. Also the sun, the moon here, we have to figure out this one. So natural sun give the is for the body 10 a.m. to 11 a.m. 20 minutes. So you make the serotonin, melatonin, dopamine, endorphin, and then support the body, the gut health. Okay. So this good make the work good decision, and then make the hormone the reproduction of the body. Okay. One of the most popular breathing exercises often used related to the stress is diaphragmatic breathing, the belly breathing. This technique involves taking slow, deep breaths, expanding more diaphragm. It's filling its lung, its air. Taking a deep breath can activate parasympathetic nervous system that promotes relaxation. This may happen more low blood pressure, reduce muscle tension, and improve overall emotional well-being. So, when you have a deep breath, then look at me. Yeah. So just try to deep breath. It's not easy. Okay. So your arm here, the shaking here. 1 minute. 1 minute here, the shaking here. And on your shoulders, like here, the stay 10 seconds, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, down. Okay. Again, the 5 times, AM to PM. Also, we have here, you have to balance the step balance here. Because over 50 age, you can stand maybe 30 seconds, the balance, body with the shaking here. Maybe we have the twist, we have brain problem. So you can check. Yeah, you try. You stand up. Yeah, stand up. Stand up, follow me. Yeah, just here, cross eye. Yeah, here, 30 seconds. Cross eye. Yeah, you're shaking, right? Yeah, because we have the brain, it's in balance. So you have to, because some of the senior people every morning, they wake up 5 a.m. to 6 a.m. body is very cold, and also cold is this season. Because we have the circulation, the bloodstream, easy, but right away, stand up, they fall down, so they the injury. Yeah, so yeah, maybe they hear bone the especially maybe bone break, maybe 6 months or 7 months, pass away usually. Yeah, so we have to keep. Yeah, we are breathing, and we lie down. If you wanna go wake up and you wanna go bathroom or you wanna some the work, your thumb, the big thumb, right? Big thumb, your left here, 100 times. This one is a more body temperature up, and then nervous system they wake up, warming up. So it's not accidental, okay? So this one you can check your balance here. Yeah, 30 seconds here. I'm shaking my body too. It's not easy. And then also when you deep breath up, yeah, first time here, 1 minute here, you're stretching here, touch here, and okay. So it's more oxygen in the show to come out. Okay, it's very important here. So maybe try, maybe week. It's more comparable, but first time very difficult. Okay, it's not used to. Yeah, so the deep breath, they give support to the benefit, more purpose, the control, the reduce muscle tension, the improve overall emotional well-being. Another effective breathing, the technique for emotional well-being is alternate nostril breathing. the yogic practice, and that is Shodhana. This kind of I will usually we have Pilates yoga, Qigong, right? The meditation. So Ayurveda and the chakra, they or the technique, they the deep breath. So deep breath, we have a benefit. You can empty brain. So don't think about anything. Just music very slowly. The music, yoga music or the natural music, very loudly, maybe volume 3, and empty our thoughts. Everything. So only you sit down and you hear the hand is out because here you have back from here. The head more energy come out here. Yeah. So this way, the stone here, you close eye, the deep breath together. So only the focus place here, they will give you energy. Okay, the first energy. And then this one is minus energy here. This one, yeah. This technical involves reading thoughts, not straight time, orienting the between the left and right. This can help balance the body, energy flow, the clearing the mind, the promoting emotional balance, and then mental clarity. The breathing techniques such as the pranayama, the qigong, and the mindfulness meditation can also help improve more emotional well-being. Their practice include more breathable breathing, the technical and the exercise that can help the regulate emotion, reduce stress, and increase more feeling over relation and well-being. But behind the specific breathing, the techniques simply being or have our burning thought, they can have a profound impact or emotional well-being. By paying your attention to our breathing and practicing deep, the mindful breathing, you can correct the percentage and the orange that allow the negatives of challenging emotion and then situation more easily. Yeah, so depression or sometimes anxiety and panic, the fear, they escape from the deep breath, okay? Because of deep breath and the mindfulness and then more emotionally and then the physically is more very relaxed with the connection too, okay? The links between breathing and the emotional well-being is undeniable. By crafting the conscious international relations with our birth, we can help us empower to level our emotion, reduce stress, improve our mental health. The practicing mindful breathing techniques can help you create a sense of inner peace designed that positively impact every aspect of your life. Okay, so inner and then outside body you connect together. So maybe inner is more comfortable, more easy movement, more expand more the boundary area. Maybe inner has limit and it's not hurt. We are limit the movement. Okay. Here, the EFT, emotional freedom, this one. Okay, guys, the EFT tapping. Tapping, yeah, very easy. Explain to you. Acupuncture, you have the acupuncture needle inside here, acupoint, right? The massage here, with using thumb with the plus or minus the energy. And the tapping, EFT, the tapping. We touch, right? We have to touch the tapping. Tapping, so we don't need a needle, we don't need a thumb, only we have to give the touch, tapping. So tapping, we have usually have nervous system, we connect to the brain. So we have the acupuncture theory here, we have a device. Yeah, protein device, liver, heart, the kidney, bladder, or the kidney, the bladder, we device it here. Also, we have the 3 spine, we have the acupoint. Yeah, acupoint here. Chakra, ayurveda, chakra, we have a change here. Chakra here, 2, 3, 4, 5, 6, 7. The chakra. Also, qigong. We have a qigong is with deflection and the breathing and the movement slowly, qigong, right? Yeah, qigong. So they using the acupuncture, Chinese medicine, the chakra, ayurveda medicine, qigong. They usually have a nervous system connect here. It's not only the movement, the body, no. They connect the body, the mental together. Also here too. So the guided EFT, the emotion, E means the emotion, F the freedom, and the technical. So we tapping, okay, tapping. So why the EFT emotional freedom and the connect God health and the more mindful and then your mental problem we see, okay. This one guided EFT tapping. The emotional freedom, the technical EFTs, which people often refer to as EFT tapping, is an alternative therapy for anxiety, post-traumatic stress disorder, PTSD, and some other condition. According to the world developer of EFT, Greg Crane, he published this the research in the tapping theory. Different parts of our body help balance energy and reduce physical and emotional pain. The people can see our EFT practitioner for treatment or treat themselves using this technique. So, Chinese medicine, acupuncture, massage, somebody hurt my body, right? But EFT technical, this treatment, you can see, you can the body itself. So maybe they give you plus energy. Yeah, it's my energy, minus energy, right? But usually they give the energy and then we this energy we balance. But freedom, so you can by itself. So this energy, my energy minus, but the body's minus, the plus isn't better. It's freedom. So you can see maybe usually you have problem here, maybe here problem here, tapping here, tapping. We don't need maybe 10 times 1, 2, 3, 4, 5, 6, 7, 8, 9, or just problem here 1, 2, 3, 4, 5. We have lower pain or the sore pain. We have some of the pain here, so we give the tapping here more needs pain. So that tries the emotional. Yeah. So because all the body. You have an acupoint, right? Acupoint, and then acupoint is similar. So they connect to the brain. So we tapping, they emotionally more pain relief. Okay. No side effect, anything. Okay, more easy. There have been relatively a few studies on EFT, but the body of research had gone in recent years. This is the article we discussed the theory and research behind EFT and explain how to practice this tapping in the technical and the home. Yeah, anytime, anywhere you can do that. Okay. What is EFT and who uses it? This one. EFT, also known as tapping the psychological acupressure, first came to prominence in the 1990s when it developed the great psychotherapist. The first information about the theory in his website. It involves tapping the specific point on the body, primarily on the head and the face, or the particular skills. Yeah, usually here we have a lot of hair, the brain here. For example, here, the top hair, we have a back hair. Yeah, back is come here. Usually here, the head here, body here, here. Also the body here, and the head here, head here, and here. So they have some of area have some problem. My body problem here. You touch here. There is some painful here. You know, right? You can try. You can touch your head. Maybe some area it's a little pain. Yeah, because they have problem. They have a his here. Yeah, head is in here and the body is in here. They connect here. And most of the head here. Also the face too. Face, we have the face to connect to your body, and then usually hands, the feet. But you can see, you can using the head, the face is much better, okay? Because the face too. Face you have the kidney or lung or the stomach and the liver, everything. We connect it here. Yeah, usually using this position too. According to the EFT International, the technical can be helpful for people with this benefit. Anxiety person, depression, the chronic pain, the stress, the weight loss issue, the other problem. How does it work? You can see here. Maybe you can use in the 5 minutes. It's okay. Okay, you cover the body. Added acupuncture and acupressure, the tapping involving the body's energy meridian point, which are the connect the Chinese medicine. The proponents believe that we are aware of body thoughts which energy follow. So we have the energy follow here. So we have 14 here, right? So they have a change here. They connect here. So maybe the liver here usually eye, right? They come here, they come usually here, eye here. So maybe eye and your digest here together is more hard, okay? In this story, it's blackly imbalance in the Palau energy is real the health. According to EFT, advocates the tapping under the meridian point in the finger street. Restore the balance of energy, resolve the physical and the emotional issue. It can also occur in a similar way to mindfulness, and it can draw the person's attention to their body and the breathing. It may be solved its mental distraction from the issue they are causing anxiety or stress. So together, deep breath together. Yeah, breathing here. Yeah, before or after deep breath, it's very different. The more after the deep breath, the more tapping, it's more energy flow, it's more easy. Yeah, good circulation, okay? How to do EFT tapping? The people often use EFT tapping when they are feeling anxiety or the stress, or when they have a specific issue, they usually like the result. However, it may also be beneficial or person before the event that the expected will cause stress or anxiety. How to do EFT anxiety tapping? I show you the tapping. The people often use EFT tapping when they are feeling anxiety or stress, or when they have the specific issue, they would like the result. However, it may also be beneficial for person before event that the expected will cause or stress anxiety. identity issue. The first of all, we have 5 steps. The 2 usually tapping, or the 5 step. Number one, identity issue. During the step, the person thinks about the problem is that you should resolve. They should only choose or you should focus on one time. So meaning, I told you the meditation is anti-stomach or anti-thought. Yeah, not stressful or mindful, right? Only tapping, only focus here. And then only this area, the liver. So maybe think about the focus identification. What point here? Liver, the spine, or thorax, or stomach, or bladder. Maybe this kind of the body organ. And then we tapping. I want to give this focus, this position. I give it energy, okay? So you more identification of the issue. The second, test or irritable intensity. The person should lack of the intensity of the issue on the scale 0 to 10. Yeah, 10 being the worst of the issue have been. This ranking system allows the person to assess the effectivity over tapping and the work treatment. We have the assignments. We have pain control 1 to 10. So maybe tapping, maybe 1 you are press 1 slow or more quickly here, or you are big. You're tapping maybe 6, 7, maybe more press here. Don't too much strong. You're too weak. The middle of standard here, maybe 7 kind of press here is more easy, effective. Okay. Yeah, the 7. The setup. The third. Before beginning each round of tapping, the person should be decided or simple reminder. First, repeat or while tapping the correct jump point. This point was center or fresh part of other hand. So usually any kind of tapping, no, okay. We have the last week I give the picture of the tapping the position to you. So you can you have to follow your symptom of your disease or condition. Or maybe usually you have the eyes, you have an eye problem where you can see here, here, tapping 1, 2, 3, 4. Here, the tapping 1, not this one. 1, 2, 1, 2, 3, 1, 2, 1, 2, 3, 4. So you have to start to do this step. Yes, much better. Okay, I give it 7 point standard, the calculator, right? The reminder, first you should have acknowledge this issue and then complete set of acceptance in the spike in the, for example, the person might choose to say, even though I deeply in the completely accept myself. This means, it's a positive energy. Okay, so I give this organ here the point, I give the energy, plus energy. Okay, maybe you think maybe negative energy, maybe your body this reaction. Yeah, the effective question is more negative energy. So give the plus energy, okay? Yeah, mean the plus energy and more negative energy, this means the massage, okay? Massage using palm. Maybe press, give the more, the plus energy. This one, maybe massage here is a negative energy. They take out, come out. This one, give the energy, is plus energy, okay? Is tapping. Yeah, tapping is both. Yeah, tapping is more top plus energy and then come out. Rhythmically here, they come out. It's a negative energy. That's why it's a freedom of energy. Okay. The top of our head, that's in the center of our top of our head. The top here, I told you, is north south, right? So here, try the one north and south, west, the east. Okay, so we have first here, the center here, 1, 2, and the north, south, west, east. So we here the head here, maybe the comparable the mindful. The beginning of our eyebrow, the beginning of our brow is just about the side of our nose. Here to here. This one. Yeah, this one. It's more stress for anxiety here, much better. And also here too. The sinus problem here. Okay? Yeah, so that's why I give one picture for you, okay? The side of eyes on the bone and the outside corner and the eye. Under here, maybe you are shaking too much tired, dry hair. Here, yeah, it's a Chinese medicine. The acupuncture 정면, they have a tear the ball. So you too much dry hair, you're tapping here. Okay. Under nose, the point between lower and the upper here. Here, very important here. This is very important here. This is sometimes the stroke people were the pass out. Maybe here. Yeah, so usually the acupuncture needle here to wake up here. So you're tapping here. You have too much stress, put something, disease, something here. Yeah, this one here. Okay? You have a 1, 2, 3, 1, 2, 1 stop, 1, 2, 3. And then 2 time is more easy, okay? The beginning of our collarbones, the point there, the breastbone and the strength, the collarbones, first leave here. We have the breast, the center here. This is very important here. This one, usually belly button, we have the minus energy, in the plus energy more, we have a good maintenance of our health. Maybe jumping here, is very important here. Maybe the breast here, maybe press very sore. Yes or no? Yeah, you touch the center here. Yeah, very, because they have chi energy. So you have to chi here, it's more the balance of change the chi. Okay? So maybe sometimes you hear so much the press here, the pain, maybe the female, the brother clap there is uncomfortable here. Usually they problem too. The underarms and the side of body of the point below the arm here to here. Then here, they touch here, they connect the shoulder and the leg. So we have here, yeah, okay, this part. So we have the 10 position, how we control, we have mindful or the emotional problem. Also, they more anxiety, more depression with the control this area, okay? The 10 points, that's why I give to you picture. When tapping, use 2 more finger trip and then repeat or tap approximately 5 times each point, okay? 1, 2, 3, 4, 5, okay? Let's stop, 1, 2, 3, 5. While some points, for example, E, B, S, E, or U, E, have a twin point on the other side of the body, it's only designed to tap on the side. However, individual can tap those points, the both sides of it, both hands are free. So you can using the left hand and the right hand, and the both arms together. Okay. The same way the energy flow, the plus energy or the negative energy too. The test intensity again. Again, then cover intensity over the issue on the scale 0 to 10. I think this will have improved. Repeat the word process until the intensity reaches the word 0, the correct. This means you try the 10, but later it's used to your body. They come out, oh, it's energy power, maybe you want to reduce. So maybe 10, more 7, or 5, yeah, 3, yeah, 0. So maybe more strong, but later you can use your body so become your technical or energy. Maybe 2 or 3, they becoming the energy flow. So you can decline it. So you don't need the strong, okay? Very tightly here, much better. But before you start to do more, and then more here, it's more your body the reaction, okay? Yeah, so here, look at this screen. We have a point here. I copy for last week. This one, okay? Yeah. Okay, what does the research say? The several design studies suggest that EFT may be effective with some the condition such as anxiety and then PTSD, the trauma. However, the research to date limits that some are the studies very small. On discretion, the sum of the year studies have followed their science results unavailable. Okay. In the section, we looked the current scientific evidence to support our effective EFT for anxiety, depression, and then PTSD. EFT for anxiety, the work, the research over EFT relates to the treatment over anxiety. 2006 review, the 14 studies, EFT report that people who use tapping the experience, the scientific decrease in anxiety. However, the authors recommend future the study to compare EFT with standard treatment, such as cognitive behavioral therapy. I studied CBT 4 years ago. There is a CBT, cognitive in the brain, and then you are the point. EFT is very powerful treatment for the benefit of the anxiety and then depression. Okay, so we have one more the randomized control trial from the same years. They compare effective EFT and CBT in the treatment of people in both anxiety.